Hello, good night. My name is Sandra Samuels, CEO of Totally Mail Limited. And tonight we want to discuss the very important topic of prostate cancer. I don't know if everyone knows, but this month, the month of September, because we're at the end of September, it was Prostate Cancer Awareness Month. Now, why am I choosing this topic? Well, Totally Male, it's an all-male spa, and we want to ensure that our clients and friends have this information so that they can stay healthy, wealthy, and strong. Tonight, we have two wonderful guests, one a prostate cancer survivor, and one who has chosen the career of urology. We want to introduce Dr. Belinda Morrison, Blidgen, Mrs. Blidgen, and we want to also introduce Robin Levy, my friend, my fellow Rotarian, and prostate cancer survivor, willing and was very willing to share his story. Now, when someone is willing to come forward and share their story about their struggles, I myself, a breast cancer survivor, we have to give them kudos because sometimes it's not easy, especially we know how men can be shy. But I was only too happy when Robin was willing to share his story this month. And Belinda, I promised you, and although it's the last day of the month, as we know, this is a 24/7, every day of the year disease, although we're at the end of the month, we are going to still impart the information and encourage our guests, on our customers, our viewers online to go out and get tested once they qualify for the age group that needs to get tested. So let me firstly introduce my guest. I will introduce ladies first. So Dr. Belinda Morrison Blidgen is a consultant urologist at the University Hospital of the West Indies. She is currently a senior lecturer and head of the Division of Urology at the University of the West Indies, as well as program director of the urology postgraduate training. She completed undergraduate and postgraduate training at the University of the West Indies, Mona campus, and an elective in urology at the University of Toronto, Canada. Her areas of academic interest include prostate cancer and andrology, specifically in sickle cell disease and prostate cancer, where she has published several articles in peer-reviewed journals and book chapters. Dr. Morrison has made many local, regional, and international presentations to audiences in her field of urology, distinguishing herself in being awarded the American Urology Association's Best Poster Prize on 2 occasions. She is extensively involved in research, particularly as it's related to describing the epidemiology of urology disorders in sickle cell disease and prostate cancer in Jamaica. Dr. Morrison is a volunteer at the Sickle Cell Unit, where she performs regular monthly clinics as well as the Jamaica Cancer Society. She is a past president of the Jamaica Urological Society, past president of the Caribbean Urological Association, and member of the Medical Association of Jamaica, American Urological Association, and Sexual Medicine Society of North America. So we are carrying you a very, very experienced, exposed, learned doctor, Dr. Morrison, and let me now introduce Robin Levy, BSc Accounting from UWI, MBA Finance from Marist Business School in New York, certified fraud examiner, 15 years as Deputy General Manager of the Jamaica Stock Exchange, 8 years now as Group CEO of Jamaica Cooperative Credit Union League, past Rotary Assistant District Governor, and past President of Rotary Club of Downtown Kingston, 4-time Paul Harris Fellow, represented Jamaica in chess, Boys Town in Masters League football, and UWI and St. George's at cricket. Justice of the Peace, mentor for at-risk youth. STGC is at St. George's College, OBA executive member, director and trustee of several companies and pension funds, and a father of 2. So this is a very busy man, and he has given us his time this evening. Welcome to both of you. So we'll start with you, Belinda. You don't mind if I call you Belinda or Doc?
No. Belinda is fine.
Okay, all right. So Belinda, let us just start with the basic. What is prostate cancer?
I always like to first say, what is a cancer? Because I think we should start there. So a cancer is a disease state, because it's not normal, where there is an imbalance between cell growth and cell death. And if you think about it from the most simplistic way, when a baby is born, I mean, even before the baby is born, you get pregnant, you go and do that ultrasound, and they show you this tiny little thing on the screen. It's just a cluster of cells. But there is something genetic which is driving the growth of those cells. And for it to, within that growth of cells, that mass to become a formed human being, but within each cell, there is direction from a genetic signal to become a heart, a kidney, lung, brain, you name it. But then when the baby is born and is formed and whether be 6, 7, 8, 9 pounds, that child continues to grow and grow and grow until you reach a stable state. So within each organ, you will get to a level of stability. Within each cell, within each organ, within each system, you should always have cell growth. But there is something that regulates cell growth, because we don't grow to be giants, right? There is something that is going to checkpoint, also genetically driven, that is going to tell cells, you know what? Do not grow any further, or rather to die. So within each organ system, there's a balance between cell growth and cell death. It is natural. It is all physiological. You must have cell death in some, in every system. So cancers generally occur when there is a genetic signal resulting in increased cell growth, unregulated growth, or genetic signal, which is a mutation that is preventing cell death.
Right.
You either have unregulated growth or lack of death. In that way, the tissue now becomes overwhelmed with cells. And they then start to become very bizarre. They can go beyond the confines of the periphery of the gland. They can spread. And the more aggressive they are, they can do very, very awful things. So it's not just about growth and going beyond the confines, because if that were so, it would just be a big lump and you can take it out. But more aggressive it is, it has a potential to spread, to pick off and spread through the bloodstream, through the lymphatics, you name it. Now, every cancer has its different risk factors. It's not the same for each. Some of the risk factors are related to genetics, which is a big thing. Some of the risk factors are related to race. You will hear of some cancers that tend to occur in some racial groups versus others. Some risk factors are related to exposure. Cigarette smoking is one. Lung cancer you get because of cigarette smoking. We as urologists treat bladder cancer because of cigarette smoking. There are environmental risk factors that persons can get. Persons who have been over the years exposed to talc and chalk can also get lung cancer. persons who work in mines can get certain kinds of cancer. The point is, you may be born with a genetic risk, which, depending on how bad it is, it may result in you having a cancer, or you may have environmental exposures. Environment also includes dietary exposures that triggers, that change. So prostate cancer just happens to be one of those cancers, but a cancer can occur in any part of the body. It's just that you have cancers with varying frequencies. It so happens that prostate cancer is number 1 in Jamaica. In the US, it is number 2, second only to skin cancer, because that's a cancer that Caucasians get very commonly. So overall, it's a very, very common cancer, but know that the same abnormality can occur in any organ system and can result in potential for death. Now, every cancer has a different biological aggressiveness, even within prostate cancer. We talk about it being heterogeneous. And what we mean by that is I may have 10 patients on any given day with prostate cancer, but varying aggressiveness. I may have a man who has prostate cancer that has not caused much problems. I will never ever cause a problem. And I could recommend for him just observe, do what we call active surveillance. And then I may have another patient who comes in with prostate cancer where it has now spread and metastasized, and I have to be very aggressive and, very rigid about adhering to treatment protocols. So it's a disease of varying biological aggressiveness, and so are different cancers in the body. But prostate cancer, even within itself, has biological differences in aggressiveness. But in Black males, it tends to be mostly aggressive. Not in all, but in most of our Black males, it tends to be aggressive. So when we look at like data from the United States, where Blacks are considered minorities, we are, because I think we form, perhaps 10% or so of the American population. Despite being a minority, Blacks have the highest rate of prostate cancer in the United States. And not only that, they have the highest death rate from prostate cancer. And we can talk later on about what causes, these disparities. But the point is that it is a disease. It's not normal. It can cause loss of life, but it is very common. Hence why we are here today talking about it.
Men tend to shy away from going to the doctor overall, not just to deal with prostate cancer or anything. How can we get men to, I like, my reason for selecting you is that I wanted to show them that there is a female in the space where they can go and get tested and not feel nervous or shy or fearful, because apart from your wealth of experience, men really prefer to deal with females. So that's why I definitely wanted to bring you on the program this evening to let them know that they have options.
Yeah.
No, we are faced in Jamaica hearing that it is the number 1 cancer in, not just in our men, but overall. It's the leading cancer in Jamaica. Is there anything that our men are doing why this is the case?
Unfortunately, no. It's just one of those things. As I said, every cancer has its different risk factors, and the major risk factors for this cancer, men cannot control, and it's unavoidable. So the major risk factors are increasing age. So as a man gets older, it is more likely to occur, regardless of whatever different things he may try to do. Aging is a risk factor. When you look at the age group that tends to start getting the disease, it's most likely diagnosed at age 40 and above. But the age band where we see most cases diagnosed is between 60 and 74 years of age. It's not to say that younger men in their 40s and 50s don't get it. Definitely they do. And perhaps if more of them come forward to be checked, we find that more of them do have it. But the biggest age group is 60 to 74 years. And it's always been said that prostate cancer is a disease of aging men, and it probably is true, but 40 is still young. And I've treated many men in their 40s. So it's a risk. That's a risk factor you cannot change. The other one is, as I mentioned before, the racial background. Being Black makes prostate cancer diagnosis more likely in a family or in a population, and also aggressiveness for the disease. That's not something you can change. Genetics as well. There's something called hereditary prostate cancer, where men may get prostate cancer if they have a family history of it, particularly if family members were diagnosed younger, like less than 65, or they have more than one family member. And again, that's not something you can change. So it's family history, it's age, it's racial background. Those are not modifiable. The one thing that is potentially modifiable and is thought to be a risk factor is the lifestyle and environment. So lifestyle from the perspective that generally unhealthy lifestyle in terms of diet. So lots of fried, fatty, processed food, not sufficient fruits and vegetables, insufficient, or excess of fats, fatty acids in the diet, or increased carbs in the diet. Those things are said to increase the risk, but it's not just on their own, because of obviously there are men who are vegans, who eat healthy, and they can still get prostate cancer. So we know it's an interplay of various factors. But when they have done scientific studies and looked at risk of prostate cancer based on exposure to diet, they have found that an unhealthy diet does increase the risk of the disease. And that's potentially the only area that we think we can modify. It will not make the risk go to zero, but perhaps it can be modified somehow in terms of reducing the risk. That still has not been scientifically proven. So if we know the major risk factors are aging, which all of us will become older, race, Black race, and family history, and these things cannot be modified, and the risk factor of lifestyle is still not that tangible a risk factor that we can modify to reduce our risk of getting the disease, then the only thing we can do is to try and detect the disease early. That's the only thing. So for other diseases, like things like diabetes and hypertension, people say, you know what, exercise, eat healthy, that can really reduce the risk of getting these diseases. And that is true. But for prostate cancer, there's not very much that we can tell men to do to reduce their risk of getting the disease. So therefore, what's the next approach? The next approach is to try and pick it up early, so that if you pick it up early, it can be cured, and it can be.
And on that note, what are some of the signs and symptoms of prostate cancer?
Early stage, none. And that's the problem. I think most of us are used to, even growing up, even for us as physicians, we go to patients, we take a history, we want to know what is wrong with you, what symptoms do you have. But the early stage prostate cancer will have absolutely no symptoms. And sometimes even in people with advanced disease, the symptoms can be so subtle, the patients think that it's something else. A man who has prostate cancer that has not spread will not have any symptoms, Sandra. It will only be detected when his doctor happens to do his PSA. Let me give you an example. A gentleman came to me last week wanting to be evaluated for erections and whatever else. And I said to him, you know what, go and do some labs for me. Let me see where you are in terms of your executive profile. We can talk about your needs, your desires. And you know what, that whole issue with erectile dysfunction became the back burner, because when I looked through his labs, his PSA was 90 odd.
And what is it supposed to be?
He is a man in his 50s, so it's supposed to be at least less than 3. The conversation went in a completely different route, from now talking about trying to get erections better to now doing a biopsy and seeing if there's cancer there. So this man felt well, other than the fact that he was getting a little older and erections are not strong. And that wasn't a risk, that wasn't a symptom of his prostate problem that he obviously has. That was just something isolated, a red herring. So the point is that that's how some men are picked up. Luckily, we call that opportunistic detection. It's opportunistic because he came for one thing and I just decided, come, let me do it. Or a man may come diagnosed with kidney stones and I say, you know what, you're in my office, I'm a urologist, I'm going to do everything. And it is incidentally detected. But what if we were to just do what we ought to do, which is do our test every year starting at age 40? Do you know how many men would pick up prostate cancer with? And it wouldn't be when their PSA gets to 90 odd. it would be 4 point odd, 5 point odd maybe, and you can get it and get it early. Because what the numbers tell us is the volume of disease. The higher the number, the greater the volume of disease. So really there are no symptoms early. Remember though, it's a disease that men get at age 40 and above. So those men are also at risk for an enlarged prostate. We call that BPH. And they may have symptoms of BPH while having prostate cancer, but it is unlikely that it is a prostate cancer leading to that. So those symptoms may be difficulty urinating, slow stream, going often, maybe blood in the urine. Those things are not really due to the cancer in the early stages. Now, if a man with prostate cancer has those symptoms and it's due to the cancer, it is a sign that it is more advanced. Because when it becomes advanced, it starts to take over the whole gland. It may block off the urethra, leading to urinary retention. So the man has to have a catheter in. He may start to notice he's losing weight, which is, a telltale sign of cancer that has spread. He may have back or bony pain because it has now spread to his bones, because that's one of the places it likes to go to. We are still seeing men, especially at the university hospital, coming in with paralysis, sudden onset of paralysis. They were walking one day, had a trivial fall, and they can't get up. And when they're evaluated, it's found out that they have advanced prostate cancer. Or some may come in with kidney failure because when it spreads, it goes to the lymph glands within the pelvis and blocks off flow of the urine. So I don't mean to be morbid and tell you all these horrible things, but sometimes context is important for people to understand that this is not just a disease that people just have and live casually with. If it is advanced, it's never a nice thing to see someone with advanced prostate cancer and how they behave and how they live at that time. It's not nice. And therefore, that is why we have to advocate, have to push the early detection. That's the only way.
Okay. Thank you so much. So we go over now to Robin. Robin, why did you go to the doctor? Or was it just a general checkup? How did we?
No, sorry. Finish your question, please, Sandra.
Huh?
Please finish your question.
No, that's the question. How did we get here? How did you are you a man that always take care of what I'm asking you? Are you a man that takes care of himself, go to the doctor regular, did your due diligence, or like doc is saying, just one of those things, you had some symptoms and you decided to check it out?
Well, I think I'm not much different from most Jamaican men. I really don't love going to the doctor. I did have some issues with my back and actually had to have back surgery. And in the process of that, my doctor, being very thorough, made me do a PSC, also because of my family history. In fact, prostate cancer metastasized and resulted in the death of my father at a fairly young age, in his 60s. And it's also on the other side of my family, on my mother's side. So I already knew I had a higher than average propensity to have prostate issues. And so had no problem doing my PSC, prostate specific antigen test, to see whether or not, as Belinda was saying, what my numbers were. It's always good to know your numbers. And, my PSA was not 0. It was a number, I believe. I think the first one was in the low teens. And, it was a wait and see thing. Again, I had no symptoms in that regard. And then later, the number went up. I think I eat, fairly healthy. I'm fairly active, notwithstanding, the back surgery. But as, the years progressed and I came into my late 40s now, early 50s, my regular physician said, well, we need to look at this a little bit more carefully. And I did have, by this time now, very mild symptoms, as Belinda was saying. Post-void drip was one of them. You urinate and then, you don't feel as if your bladder is fully empty. And, very mild symptoms like that. But, you wait it out. And then, of course, the dreaded male test, which is yes. And I should tell you, my physician, primary physician, is female. But I'm very confident in my masculinity. I don't know what men have as with being the problem with that. It's if you're going to live, you're going to have to do certain tests, and what that test found,
Absolutely. Thank you for that. Thank you
yeah,
for that.
what that test found was that there was a hard spot on my prostate that couldn't have been detected in any other way. And so, even though I didn't have a extremely swollen prostate, I did have hard spots on my prostate. That now meant, okay, Robin, let's do a biopsy to see if it is cancerous. And I did an MRI, and then actually overseas did what they call a MRI guided biopsy. So then what a biopsy means is taking a little piece of the prostate using a needle and testing to see if it's cancerous. Belinda, correct me if anytime I talk foolishness, right? Um, and I'm trying to speak in very simple language. Belinda, I don't have your medical vocabulary. Is with me?
No.
Same way, so. If you want to talk about financial instruments, you can talk all the technical jargon in
He's
the world.
doing
I'm just
very
telling you
well,
my
Sandra.
story.
Let me just tell him that. And by the way,
I'm doing all right.
you didn't
Yes.
recognize me as a former Rotarian, but I'm going to just jump in and
So
say,
sorry. My sincere apologies.
I know
Once
this man long
Rotarian,
time.
always Rotarian.
Exactly.
There's no former.
All right. So as I'm saying, Sandra, correct me anytime I go off real, right? And that's all like I talking foolishness. But I'm hearing you to say I'm doing okay so far.
Yes.
Okay, good. So this biopsy now, check it, reveal that yes, some of these cells are cancerous. And it now becomes a question of the choices you make regarding life. Now, as you heard, I have two children, actually fairly young. And knowing it had, effectively killed my father, um, is still a fairly young man in his 60s. I decided, after consultation with my own family, to do a total removal of the prostate itself. Now, I decided on this for a couple of different reasons. My father had done a partial biopsy, removing a part of it, and he was in remission for maybe 10 years or so. And then when it came back very aggressively. I had also heard some of those stories from other persons before doing partial removals of the prostate. And I decided, you know what, let's just take out the whole thing. And I did that. Let's see now, how long ago? 4 years ago, about 3 years ago. And since then, my PSA, my prostate specific antigen test, has been reading 0. So effectively, I am cancer free at this point in time and hope to remain so. There's really not a lot I can do, as Belinda said, except continue to, be as healthy as I can, active, and really just enjoy my life. I'm grateful to still be here and be able to not just see my children grow up and enjoy my family life and my social life, but in my own way to contribute to my fellow man. Because as Rotarians, we are serious about service above self. And I agree to this, Sandra. Thank you for inviting me to encourage my fellow man to, by all means, go out and get tested. Right?
You know that Totally Male is not just my business; it's my passion. Ensuring that Jamaican men, and my clientele is an aging population. Mr. Clark, Deshaun, I see you. We just want to take the questions at the end, so we're not ignoring your question. I just wanted to get out all the information first, and then we're going to take the questions closer to the end. Okay? Good night. Thanks for joining. What I want to find out from you, though, Robin, the fear factor, because it's real. How did you mentally tackle that? And 2, have you changed your diet? Are you doing anything different from pre-prostate cancer?
That's actually an interesting question. I have become much more conscious about what I eat. Not that it necessarily is going to have any effect. It's just that if I am now cancer free and I have, thankfully, hopefully, many more years to live unless something else gets me first. knock on wood, then I want to be in good health for these remaining years. It does focus you very, having a cancer diagnosis, as probably you would know, Sandra,
Absolutely.
focuses your mind very much on life, what it's worth, and what you're going to do with it for the remainder of your days. And you don't, one of the things I really feared more than anything else was being helpless or paralyzed. Those things it's not a pleasant thought. So yes, in all other aspects of my health, I try to be a little bit more healthy.
Okay. Did you have to seek counseling in your time? Because I remember, you survive, but you're not sure. The mental work is, to me, equally important as the taking the doing the surgery, taking whatever medication you have to take. Because I didn't realize until like many years after that it actually affected me, in in a it affected my self-esteem. But because I was just pushing through, I didn't really notice it until something triggered me. Is that something you have done, or is it something that you would consider to get counseling, or are you think you're good? Because everybody handles things differently.
Yes, everybody does. But I think universally, when you hear the first diagnosis, it's kind of a slap in the face, and it's wow, I have cancer. What's going to happen? And lots of discussions with my immediate family, my wife, mother, sister. Of course, they're being aware of what had happened with my father, and some very close friends. And I have to tell you, yeah, we had a few drinks in the rum bar to say, boy, Robin, what's next? I think it was probably more important for me to have those discussions with persons around me, and the encouragement to go out and actually be proactive rather than wait to see if this thing is going to, take its own sweet time and finish me off in my 80s or 90s as is possible if you do nothing. But in my case, given my family history, was not likely. Or having to make some lifestyle choices, the possibility of maybe having to wear diapers or not being able to have sex for the rest of my life, if these are things that have to factor into the equation. And you have those discussions, you make your decisions, and you move along. The fact of the matter is, though, it is not a death sentence. You can still do all the things you really like if most of them anyway. As men, there is a possibility of there being some of these very negative things, but again, if you work at it, there are exercises they give you afterwards which help with recovery. Being able to retain your urine after surgery is a challenge for some people. Getting an erection afterwards is a challenge for some persons. Some don't have it. I mean, it depends somewhat on the skill of the surgeon. But from what I've heard, it's really the luck of the draw. No doubt, not all men are going to be lucky enough to have no symptoms whatsoever. Some have mild symptoms. Some have, pretty severe symptoms after the surgery. But I shouldn't say symptoms. I should say outcomes after the surgery. But the question is, do you want to live? And if you want to live, there are some choices you have to make and some things you have to do.
That was my exact sentiment. I mean, what are my choices? I mean, do I want to live or do I want to die? And so I am right there with you. Doc, what is recommended? I mean, is in terms of mental care. I mean, as I said, not many people can handle the
Yeah.
diagnosis. Is counseling
Yeah.
um
The truth
a
is,
recommendation right off the bat, or it's solely up to the individual whether they want to do counseling, yes or no?
It's well, first of all, it's good to hear Robin speak about just so strong and powerfully about his experience, and I'm sure it must have shook him,
Of course.
because the day that you hear that, you just feel like the world has just stopped, because nobody sits down preparing for that and thinking about it, but to make those practical decisions. And just to touch on that point a little, the question I always ask myself is, how can we make others think in the same way? You know why, Sandra? Because we say pick up this disease early by screening. But there are some men will tell you point blank, they are not going to do it because number one, they feel well and them don't want no doctor to tell them they're not well. There's a whole issue of the rectal exam, which I think is just one of many, many barriers that we face. It's not the only one. Because even when we say, okay, forget about doing the rectal exam, let's just go with the PSA and maybe an MRI, we still have challenges. But downstream, people start to predict, well, if my erections are not going to be here, it's okay. And I have had it as an experience with patients telling me that, listen, they're just not going to go, first of all, maybe not even be checked, or if they're found to have a high PSA and I can convince them to do a biopsy, when a diagnosis comes, they're in so much either denial or refusal to accept that the possibility may lie that they will not get good erections after, and they're just not willing to live like that. Can I tell you that just last week a patient told me that his life mashed up because this is a man who about 15 years before had prostate cancer and had surgery. And unfortunately, he didn't do very close follow-up. There was some recurrence because he had very aggressive disease at the beginning. And he now has to be on hormones. But he's well and he's doing well, and his PSA is 0. And it so happened that his daughter died less than a year ago. And he said to me, what is happening to him now without erections is worse than the death of his daughter. You hear me?
Wow.
And
Wow.
it is real.
If I could just jump in,
Yes.
because men think very differently from how women think.
That's
Okay.
a fact.
They say that only women and dogs are loved unconditionally. Men have to provide something to be loved. And one of those things is sex.
Oh.
So when a man is faced with the possibility of not being able to enjoy it and not being able to satisfy his woman or woman or whatever the case may be, those are not casual decisions to make as to the possibility of losing that ability. I don't want us to think that it is a trivial matter. It's a very serious matter to men.
No. And I get that. I totally get that, Robin. I'm a woman, but I get that. And I spend most of my time interacting with men professionally and, even seeing patients. So I know. And I don't trivialize it. Just like how I don't trivialize the fear of the rectal exam, I don't trivialize its impact on erectile function. So I think a younger version of me would say, what's the big deal? Come on, it's your life. But having gotten close to patients and hearing them out, I recognize that it is a big deal and it may be a deal breaker. And I've had men, it's not just here in Jamaica. I remember while I was training for a short time in Canada, I was in clinic one day and they brought me to see a patient. They said, you must see this man, because he was Jamaican, and the man was in the oncology clinic there in Toronto. And, I was trying to get through to him and talk to him about choosing an option for prostate cancer treatment for surgery. And he said, listen, not into that, because I'm not leaving this earth without my erections. And, at that time, I just could not get it. I thought he was being silly. But I understand what you're saying. I understand what it means for a man, who he is, his quality of life. And I'll put it to you, maybe that's a bigger deal why men don't get screened than even doing the rectal exam, because the men start to get there. They feel as though their life would have ended. And so I wonder, how can we get to men to understand that it's not to say not to prioritize their sexual health, but to still understand that this disease could kill them and how it would impact their kids that they leave behind, their partners, and that we can also try in many different ways to get those erections back, because it just so happens that we are the ones who do that in our career anyway. How do we get the message out so that men don't just look at this whole month and this talk about, oh, just a big talk about prostate cancer, but we're not going to live that way. We don't want to live that way. Let's just forget about it. Let's not even get any treatment. How do we get men to understand the impact of their diagnosis on their family and the fact that, yes, erections may go south, but not in everybody. Younger men do better. Most of my patients in their 40s and 50s have very good and quick recovery of their erections. And even those who are older, there are different tools that we have to bring it back.
Actually, Belinda,
Yes.
actually, there's a friend of mine who is older than me who never lost any functionality at all, even though he did remove the entire prostate. I mean, the following week he was up and running, as I say. Maybe we're not all that lucky, but it's possible. But to your point, there are, I think modern medicine is great and the advances being made. I opted for robotic surgery, so it was much more precise. It supposedly gives you a better chance of full functional recovery. But even had there not been recovery, there are things you can do to regain erections. They may be artificial, but it can be done. I've heard of tales, and I am part of, let me say, associated with World's United Against Prostate Cancer, and one or two of the members have said, yeah, they've opted for an artificial way of continuing to get erections and have sex. So any way you look at it, any way you slice it, your sex life doesn't have to be over if you so choose after prostate cancer or after getting treatment. Therefore, how do we get men to work with that? I don't know. I can't tell you. I can only tell you the reason I did it primarily was with my children in mind.
And you see, Robin, not everybody has your level of fortitude to think in that way. Because it's not to say the other men love their children or their partners less, but they're confused. And to get back to your question now, Sandra, what are the recommendations? There are absolutely no recommendations about mental health counseling when it comes to this. I'm sad to say, if you look at any guideline from any regulatory body, for us, we look at the American Urological Association or the European Association of Urology. There's none. It is up to the discretion of the busy urologist to say, okay, I have a guy who's just been diagnosed. Let me refer him for counseling. And it hardly ever happens. Can I say that? And it's just true. We like to have support. I really like to have family support there. At the beginning, wives, partners present so they can provide some buffer so that when I'm there talking, after I've said cancer and I know all the man just sees his mouth moving, that person is there to hear, to support, to always be there to let them know, listen, I'm not leaving you. That helps. But in terms of formal recommendation for counseling, it is not written. It's not a guideline. It's not an something that has been suggested. I have sometimes seen how men deal with it in terms of avoidance of the diagnosis and just being clear cut and saying, okay, let's just do what I have to do and move on. And I may suggest counseling, but some men don't want it. They just want to tough it out on their own. And so I think that's important because we've actually, in our department of urology, had a student who came as a master student, did a study, and she found that a significant number of our patients had coexistent depression with the
Belinda,
but it wasn't being addressed.
But Belinda and Sandra, you have to understand, we are men, and we are manly men, and we don't go around talking about our problems. We don't, seek counseling. What kind of foolishness you're talking about? Counseling? No, sir. No, yeah. I have to hold it and tough it out because I'm a man. You understand? I'm telling you what the prevailing thinking is among men.
It's true, yeah.
Right? That's the thinking. As I remember, big boys don't cry, right? Isn't that how we were raised?
Yeah, but I thought those days were over.
No. Maybe for the next generation coming up, who are more in touch with their feelings,
Let me tell you something, Sandra. Even what Robin is doing here, not very easy to get. You know, last week an oncologist called me and said, Belinda, you don't have a patient who would want to talk for something for me as a survivor.
No,
And
sir.
listen, I've been trying for the whole month of September for one activity or another. Some men, I would not even reach out to them because I just know how them feel. I have another man who I said, boy, this man is a retired man now. He's in his 70s. I did his surgery maybe about 15 years ago. The man said, listen, all people in my family may still not tell. 15 years
Well,
later. So
I've been a little bit more open in sharing, especially,
And
you know,
we appreciate it. So that
yes.
you know,
Well, I mean,
it is
even before
appreciated.
this, right? So in my Rotary Club, the Rotary Club of downtown Kingston, you know, I came out and said, well, you know, I have prostate cancer and I'm going to do this thing and so on and so forth. And of course, you know, you got the support you'd expect. What was surprising to me was the number of my fellow Rotarians who said, oh, yeah, man, I had mine done 10 years ago. I did one
that is
15, 20.
correct. That is
Very
correct.
common,
Yeah.
extremely
Yes.
common.
Very.
And then it was more, it wasn't, oh, poor you. It's like, oh, welcome to the club.
That's what I always tell my patients. I always say to
Yeah.
them, listen, you think you're alone. There are many men that you know, but they have not told you. They've been there, they've done that.
Yeah,
It's so
sure.
common. And especially a lot of them have had very good outcomes. But you know what? They're not willing to come and share it for one reason or the other.
Okay, so now the thing is, we actually made a decision to have a project around prostate cancer health and prostate cancer awareness. We wanted to phrase it as prostate cancer health because the word cancer is scary, right? So, so we're encouraging men. We have this project. We're encouraging men of the correct age and who have a predisposition, or if not, just to get know your numbers and get your numbers to do at least a PSA test. And we actually have applied for some funding from National Health Fund, and we've partnered with, interestingly, Heart Foundation and Cancer Society and Brothers United Against Prostate Cancer to spread prostate awareness. And we are not afraid to talk about, you know, the fact that we have or had prostate cancer, and you know, try to encourage men to get tested and to do what they need to do to continue to be contributing members to society and to take care of their families.
Well, I was encouraged this year. I mean, I saw the prostate cancer run growing. I think last year was about 3,000 people. There are now 4,000 plus. So, you know, running events is really pushing for the cause as well as Cancer Society. So and Brothers United, because you gentlemen are going out there and speaking about and familiarizing, you know, everybody with prostate cancer and speaking on survival. Now, Doc, you said there is no, in terms of eating, in terms of healthy lifestyle, what can men do? Is there anything that they can do to say, even give themselves a fighting chance, especially like Robin, who has it in his family? Is there anything to do in that situation that you can say help yourself there?
So the truth is, from a scientific standpoint, scientific mean, is there strong scientific evidence that has linked a particular lifestyle behavior to prevention? There is no strong scientific evidence that exists. People have looked at it over the years. I remember being in Canada and there were people talking about take your vitamin E and selenium tablets. And it was
don't eat ackee.
Exactly. And the selenium and the vitamin E never panned out to be anything. Or let's eat as much ketchup and tomatoes as possible because the lycopenes can prevent it. And then it was studied and never panned out. So the truth is, there is no strong scientific evidence. Anecdotally, you see, let's put it this way, you see that the Asians have the lowest rates of prostate cancer. Eastern Asians, Chinese, Indians, people from that part of the world, they have the lowest rates. They'd have their challenge with screening as well, because it's not just us afraid of the DRE. They too are,
Yes.
for various cultural reasons. But even so, they are low rates. When they leave the countries of birth and they migrate to a Western society, their rates increase. Their rates are higher than in their home country. It doesn't reach near the blacks and the whites in the Western world, but it's
Let's
higher.
move to China. Oh, I'm sorry.
Could
Go
that
ahead.
speak
Go
to,
ahead.
so could that speak to environment then?
Could speak to environment, it could speak to lifestyle in terms of diet. So what do they have a lot of? And this is what people have looked at. Well, they drink a lot of green tea and they have a lot of soy in their diet, right? So they've looked at these things to see if those things are protective, but the evidence is still not strong. Because to show that kind of evidence, you have to do a proper study. And doing dietary studies, randomized controlled trials aren't not easy. You would almost have to have people isolated for a while and followed over years to see. What they have right now is evidence which is retrospective. From you to come to me and say, okay, over the past couple of months or years, how much of this do you have? How much of that do you have? And then say, okay, perhaps there's a link. So they don't have the evidence. So we can't say use this, use guinea hen weed, use ball mass, use this, have tomatoes. The newest thing I heard is something with honey. There's nothing right now that is strong.
Okay, Belinda, can I jump in again?
Right, go ahead.
Something that was mentioned to me, and we have these discussions, is that the amount of processed food we eat is usually significantly higher in the Western world than it is in the Eastern.
Correct.
And also there is more obesity.
Correct.
Jamaican men, we tend to have these bellies.
Yeah.
And we tend to have some unhealthy eating habits, just general health.
Yeah.
And I mean, there's no guarantee, of course.
That's right. So you add to black race, which is a risk. You add to aging, which is a risk. You probably add to family history. And then you top it off now with eating. Every day you're eating fried food, fatty food. You're not exercising. You're getting overweight. Interplay of factors. But what I'm trying to say is nobody can say, I am going to recommend that you eat this, that, or whatever. What we do know is that eating health is not a bad thing, because even for men with prostate cancer, where they've looked at groups who while having prostate cancer, you have a healthy diet. Those who do not, obviously the ones who have a healthy diet do better, because what all of these processed food and these carbs do, it creates inflammation and it makes things worse. So yes, a healthy diet is definitely something that we're going to emphasize while you have it, but we can't say that it's going to prevent it, because there's so
and being active.
Precisely, and being physically active. So I tell all my patients, whether you have early stage or advanced stage, do regular exercise.
Or no stage at all.
Exactly, your regular exercise, you eat healthy, you cut back on certain things. Remember, it's part of our culture. Culture, when we travel, that's when we see how different we eat here. I remember going to Canada, and I'm so used to at the hospital at university, lunchtime, you go and get a box lunch, if you will, right? It's gonna be rice and peas and something else, right?
Maybe and a ton of gravy, curry goat gravy or whatever, which is really just oil.
That's our standard, and we're getting exposed to that from we're probably in high school. I don't think we had much of that in primary prep school, but certainly high school cafeteria, that's what is sold. Lunch is fried chicken and rice and peas. University, same thing. Hospital food, same thing. You go to Canada now, you get a break in between surgery, which may just be 15-20 minutes. You go down to Tim Hortons, is a
salad.
Well, a salad, or well, Tim Hortons does a salad, but maybe a salad or a donut and some coffee, and that's it. This big heavy food and whatever. People don't eat like that in other places. And certainly the Asian model, they don't eat like that either. They have a lot of fruits and vegetables and low carbs.
Okay. Well, okay. So we have about almost 6 minutes left. Deshaun wanted to know what is the survival rate of men who have been treated. And I just want to let the viewers know that we have the expert online as well as a survivor. If you have any questions, shoot your questions to us now in the chat, and so I can ask them to give you the information.
Right.
So what is the survival rate like now?
Survival is excellent. In medicine, we like to talk about 5 and 10 year survival. We speak about overall survival. That means how long you live regardless of what. We speak about disease-free survival, meaning that while you're alive, how long are you without the cancer. With prostate cancer is in the 90s. It's like 95% and up. It's almost a guarantee.
If you catch it early, though.
Listen, if you pick up that disease early, it's just one of those things that you had, but moving it right along. It's really true. Some people may go to surgery. Most people, I would say, will do, say, surgery, and that's it, nothing more. A few will do surgery and may need radiotherapy after, depending on how aggressive their disease is. But it's hard to find a man that has done surgery that has failed, and then it shortens his life expectancy once it's picked up early. Sometimes I've seen very aggressive disease, though. So I've seen some men, very, very aggressive disease. But you know that from day one with the pathology report and the MRI features and so, and it may be more of a struggle. But you know what? Science is great. There's so many new drugs available that you can use that gives them a long lifespan. So survival is excellent. For 10 years or more, it's over 95%. The difference now is when it is advanced. Our textbooks used to tell us that men who have prostate cancer that's advanced generally have a 2-year period where they respond to hormones, and then afterwards it starts to go uphill. And in those days when they wrote the textbooks, we didn't have many second and third line agents. So after they lacked response to the conventional treatment, which was hormones, it usually would be another 12 to 18 months before death. That's not even so anymore, because in men who have advanced disease, even though we cannot promise them cure, because cure would only be if you can get that prostate out or you give them radiotherapy, we can offer hormones up from the chemotherapy, which prolongs their response to hormones, prolongs their survival. And even if that doesn't respond after a while, you can give second and third line agents. And there's so many different things that are available. And in a society, if you have all options, believe me, it's just a matter of moving from one to the next, to the next, to the next. So shout out to National Health Fund for bringing a lot of those agents on. There's still more they can add, but they've done a lot. There's a drug on it called abiraterone, which is a game changer, Sandra, for men who have advanced disease. When they had the brand available, that was at $5,000 US per month. Needless to say, it was not well used, but it was a good drug for those who had prostate cancer that was advanced, had not responded to hormones, and needed something for new response. Now it's on it. The patients, in fact, there's no competition because there's a brand on it. There are generic forms. It's now free through one of the brands, and the patients can get it. And I can tell you, I have a patient right now, and he's not the only one. PSA was 6,000. Remember, I told you what the normal PSA is, right? 6,000 would spread to his bones and all over, and the man's PSA now is less than 0.1. And this is 3 years and counting while on the drug.
Can I ask, are there any other questions, Sandra? Or
no, not yet.
okay.
Folks, send on your questions. I'm sure you have questions. Any burning questions? We have some time. I mean, just shoot some questions. Robin, you have this platform now. What you want to say to the men out there?
Go get tested, man. What you have for afraid of?
Them like bread.
Yeah, man. I understand what I want. Real men don't fear a little finger, you know. I understand what I want, you know. That not going to turn you into a homosexual.
Right.
I mean, if you think that's not going to turn you into a homosexual and you have bigger problems, brethren, go and get tested, find out what's going on with you. At least you have the information and you can then make decisions after that for yourself. But you see, when, you know, they say what you don't know can hurt you, that's the exact opposite with prostate cancer and with prostate health, right? Better you know, so you can make informed decisions for yourself and for your family. Simple as that. At least do the MRE. It's just a blood test. I like a prick and them take some blood and them tell you, and them you know, they tell you what your PSA is, and that you have a number. The number doesn't necessarily mean anything by itself, but is a starting point for you to start having a discussion with your doctor, who will, you know, hopefully you trust them, or if not, get a new doctor, and then start having a discussion about what your options are and what treatment possibilities there are. It's not a death sentence, not anymore. If you leave it though, and don't get tested and don't make any decisions, them say denial ain't just a river in Egypt. Denial is a real thing, right? That is when you're going to start now. As Belinda was saying, you leave it untreated and then it spreads, and then it's a whole other set of decisions you have to make now about how much longer you have to live. So go and get tested so you can make decisions. Simple as that. Nothing to be afraid of.
Okay, so when I'm talking to my clients, I go from a different angle. I don't mention the word cancer at all. I speak about penis health.
Prostate health. That's where the discussion needs to go.
The penis and prostate, because they connect the penis to the prostate. So to them, it's about the penis. So I speak on penis health. So I've been advocating all month for them to go and get tested. I've tried to find out who has not gotten tested, why they haven't gotten tested, and so forth and so on. So we're having a conversation, But as you said, the fear factor, how to get beyond the fear, and there's also fear of losing their spouse if that is the situation. If they do find out that they have prostate cancer and they may lose their erection, that is also a fear factor as well, that they may lose.
So Sandra, here's the thing. What we had determined to do was to get women involved in this. We want women to say to their men, listen, you need to go get tested because I want you to be around and I want you to be in good health. For my sake, go and get tested. Right? And we need to almost make it a macho thing. Real men get tested for prostate cancer. What's wrong with us having a campaign like
right? So it's
and destigmatize this thing. We do need to destigmatize and to have a discussion about, if you want to call it penis health, that's fine. Although with the prostate is much more than penis.
Yeah.
It's other things. But yes, that one will get home to them.
Yeah, it's the way you think. Because we know it's a prostate and the whole 9 yards.
So Sandra, you women can say, oh, I think it's sexy if a man goes and get himself tested. What's wrong with that?
I'm sorry, I didn't hear that.
You women need to go tell the men in your lives, I think it's sexy. Go and get tested and we can discuss what's going to happen next.
Well,
maybe you get something a little extra if you go get tested.
I am in the business of self-care. So we at Totally Male do find it very sexy when a man takes care of himself and when he puts his health at the forefront. But as Doc was saying, her challenge is selling the Kool-Aid. How do we sell it to those who are stubborn and don't want to budge, even although they have children and they have a good life going on, and they want to live and they want to survive and have a wonderful life, but they're just not moving.
So Robin, I think Robin's approach is correct.
Yes.
I think involving the women, it has to be that way. If you're leaving it to the men alone, it may not happen as much. There are institutions that will push it, I mean, the army, they have to do it. Certain executive positions, they have to do it. They have to get tested. Lots of big institutions that you think would need to do it, they don't. But the most effective way I found is women calling in and making appointments. And that's why each time I give a talk at an institution, even if there are mostly women in the audience, I'm happy because they're going to go home and set it straight. Sometimes it just hits the nerve and they say, wait, but I haven't seen my husband go and do his thing or whatever. And your
husband, your father, your brother, any man in your side man. I mean, well, not that one. No, well, that's somebody else's problem. But all the men in your life, right? Ask them what the situation is. Ask them what the situation is. Yeah, man. We have to make this a macho thing now. Real men go get tested, You're not a real man unless you know what your PSA score is. They start bragging. Mine is 0. Well, mine are 2, but watch me. I'm going to work on it. I mean, I don't know. we need to change. We need to flip the script and make it not about fear, but about something positive you can do for yourself and those around you.
So, Doc, where do we find you?
So I am currently located at University Hospital of the West Indies, but privately I'm at Mona Institute of Medical Sciences, and that's located on the University Hospital compound, also called MIMS for short. You can find me on Instagram as Urologist Solutions JA or Facebook at Urologist Solutions JA.
Okay. And I noticed in your bio, you do, is there a correlation with sickle cell and prostate cancer? Is there a reason why you do the two disciplines?
Funny enough, no. Sickle cell disease was just near and dear to my heart because when I finished residency, I did a 3-year research fellowship and I was posted at the sickle cell unit. So I was just there taking care of the men. And there are some conditions that the men would have that everybody will talk about. But in volunteering there, I started to talk to the guys and realize that there are many other things that affect them. And so, believe it or not, I don't see prostate cancer in the sickle cell population. So, yeah.
Interesting.
So
not encouraging men. Oh, they can't catch sickle cell.
You can't get it right.
I noticed you didn't ask me where to find me, Sandra. But that's okay.
I'm coming to you now.
Appearing at a rum bar near you. No, I'm just joking. I would encourage persons to look after not only their physical health, but their financial health. Join our credit union today.
Yeah.
Right.
Yeah.
So and also you mentioned Brotherhood
United
against prostate cancer.
Yeah.
Right.
And
where does that group have a regular meeting? How do people become a part of the Brotherhood? You have that.
You can start by just researching it online, and
What's the current name?
There are numbers I can give you afterwards, Sandra, that you can publicize.
Post on the page, okay? And that's Brothers United, you said?
Against
prostate cancer.
They have an
Brothers
Instagram
United.
page.
Okay.
They have an Instagram
Brothers
page and
United against prostate cancer. So persons out there, I know some people are shy to ask questions, but you can always go to get in touch with that group, or you can call Dr. Belinda Morrison and have your own private consultation and just sort out your health, because your health is your wealth.
True.
Well, it was a very interesting program, and I'm very happy that I was able to make it happen. I promised that I would, and it is very near and dear to me because, as I said, my clients mean everything to me because they come in like family members. So I'm not interested in losing not even one. And I do have an aging population at Totally Meal, so I have to look out for them. So thank you so much, Robin.
Pleasure.
I mean, I can't say enough for, I don't even want to call it bravery, for your input as a man speaking to other men on a healthy lifestyle and, taking care of themselves. Kudos to you. Respect gone up enough, and I just really, truly appreciate it. And I hope that you see the thing is, if you even reach one, the job would have been done.
One by one.
One by one. We just have to support each other and keep it moving. So thanks, guys. Thanks for everyone who was on tonight, and it will be posted on the pages. And I will send it to you, Belinda and Robin, so that you can also post it on your page as well, so that the information can just continue to rotate, and it will be on YouTube. So, okay, so Deshaun is saying, I think there has to be a more holistic approach to creating awareness through the involvement of a number of stakeholders. Men struggle with just the thought of losing their manhood, which is what you were saying before, And yes, Deshaun, we definitely know that. But we're saying we each have to, play a part. Women as well, the spouses, the mothers, the sisters, the the daughters to push the men to go out to get tested. What age you say we start, Doc?
40.
40. And they have it already in their family?
Still 40.
Still 40. Okay.
Yeah.
So there's nothing to do before that.
No.
Okay. All right. So
Except lose the beer belly and eat healthy.
Huh?
Except
Get
lose the
rid of
beer
the
belly
beer
and
belly.
eat healthy.
Absolutely. Cut out the fried food, cut out the smoked food. They but you know we also struggle with the genetically modified food as well.
Yes.
So, you know, but we give thanks. Every day we still give thanks. Every day we wake up, we give thanks. And I give thanks this evening for all the viewers that joined us tonight. Thank you so much for coming, and have a wonderful rest of the week.
Thank you
Next
for
month,
having me.
shameless
Thank
plug.
you.
Next month is breast cancer month, and it's month next month, and you will see me again. But on that platform, it will be speaking on breast cancer. So
Okay.
thank you so much, everybody.
Thank you.
Bless you.
Have a good night,
Thank you.
everyone.
All
Good
right.
night, everyone.
All right.